Which profiles are predisposed to anxiety? Understand which profiles are more predisposed to anxiety and the risk factors that can influence the development of this disorder. Learn to identify if you fit into any of these profiles and how to effectively deal with anxiety. Have you ever found yourself ruminating on negative thoughts, imagining the worst possible scenario in every situation? Do you feel that uncomfortable sensation in your chest, as if the world were about to collapse at any moment? If you resonate with these symptoms, you may be facing a picture of anxiety. But are some individuals more prone than others to develop this disorder? The answer is yes. In this article, we will explore the profiles that are more predisposed to anxiety, helping you identify if you fit into any of them and, most importantly, providing tips to cope with this condition. Discover 10 profiles with higher predisposition to anxiety. 1. Traumatic events. Significant experiences such as harassment, domestic violence, loss of a loved one, difficult separation, or insurmountable grief can trigger a state of post-traumatic stress and, in the long run, favor the development of anxiety. How do these traumatic events contribute to anxiety? Post-traumatic stress. Trauma can cause changes in brain function, making the individual more prone to reacting with fear and anxiety to stressful situations. Intrusive memories and flashbacks. Recalling the traumatic event can generate intense anxiety and emotional distress. Avoidance of triggers. The individual may avoid places, people, or situations that remind them of the trauma, which can limit their life and increase the sense of fear. 2. Childhood experiences. Traumas in childhood, such as neglect, abandonment, bullying, or family instability, can leave lasting marks on emotional and mental development, increasing vulnerability to anxiety in adulthood. How do these childhood experiences influence anxiety? Insecurity and low self-esteem. The lack of a safe and nurturing environment in childhood can lead to feelings of insecurity and low self-esteem, making the individual more prone to anxiety. Difficulties in relationships. Childhood traumas can hinder the formation of healthy relationships and trust in others, which can contribute to social isolation and anxiety. Emotion regulation difficulties. The lack of healthy emotional regulation models can hinder the individual's ability to deal with their emotions, increasing the likelihood of developing anxiety. 3. Cognitive traits. Individuals with excessive rumination, a tendency to catastrophize events, and difficulty coping with uncertainty may have an exaggerated response to stress and greater difficulty regulating their emotions, making them more prone to anxiety. How do these cognitive traits contribute to anxiety? Rumination. Repeatedly focusing on negative thoughts and worries can increase anxiety and hinder concentration on other things. Catastrophizing. Interpreting situations as more threatening than they really are can lead to a constant state of alertness and fear. Intolerance of uncertainty. Difficulty coping with ambiguity and lack of control can generate anxiety and apprehension. 4. Chronic stress. Work pressure, financial problems, family conflicts, or prolonged stressful events can overwhelm the nervous system and trigger anxiety symptoms. How does chronic stress contribute to anxiety? Activation of the sympathetic nervous system. Chronic stress leads to constant activation of the sympathetic nervous system, which is responsible for the fight or flight response. This can cause symptoms such as tachycardia, sweating, tremors, and difficulty breathing. Hormonal imbalance. Chronic stress can lead to an imbalance in stress hormones, such as cortisol and adrenaline, which can increase anxiety and irritability. Difficulty concentrating and memory. Chronic stress can impair the functioning of the hippocampus, an area of the brain important for memory and concentration, which can make anxiety control difficult. 5. Personality and temperament. Introverted individuals, perfectionists, sensitive individuals, or those prone to excessive worries may have a higher predisposition to develop anxiety disorders. How do personality and temperament influence anxiety? Introversion. Introverted individuals may be more prone to social anxiety, as they feel more uncomfortable in social situations and prefer calm environments with few people. Perfectionism. Perfectionistic individuals may be more prone to anxiety because of the pressure they put on themselves to be perfect and the fear of failure. Sensitivity. Sensitive individuals may be more prone to anxiety because they are more susceptible to external stimuli and have a greater perception of danger. Excessive worry. Individuals who worry excessively may be more prone to anxiety because of mental rumination, which is the tendency to repeatedly think about negative thoughts and worries. 6. Presence of other pathologies. Chronic illnesses such as depression and epilepsy may present symptoms such as increased heart rate, digestive disturbances, or intrusive thoughts, which in turn can trigger anxious reactions. How can other pathologies contribute to anxiety? Cardiovascular diseases. Conditions such as hypertension and cardiac arrhythmia can cause symptoms like palpitations and shortness of breath, which can be mistaken for anxiety. Respiratory diseases. Conditions such as asthma and chronic bronchitis can cause difficulty breathing, which can exacerbate anxiety. Gastrointestinal diseases. Conditions such as irritable bowel syndrome and gastroesophageal reflux can cause symptoms like nausea, vomiting, and diarrhea, which can be confused with anxiety. 7. Family history. Genetics alone does not cause anxiety, but sets the stage for its development. Family upbringing and habits can influence the predisposition to anxiety by transmitting fears and intense reactions to certain situations. How can family history influence anxiety? Genetics. Studies suggest that genetics may play a significant role in the development of anxiety, but there is still no specific gene identified as responsible for this condition. Upbringing. How anxiety is addressed within the family can influence the predisposition to it. If parents are anxious, children may learn to handle situations similarly, increasing the risk of developing the disorder. Family habits. Habits such as excessive caffeine consumption, lack of physical activity, and irregular sleep can increase the risk of developing anxiety in individuals with a genetic predisposition. 8. Substance use. Alcohol abuse, cannabis dependence, or medication use can affect the central nervous system and cause mood imbalances that accelerate anxious behavior. How does substance use contribute to anxiety? Alcohol. Alcohol can heighten anxiety in the short term, and over time, led to the development of an anxiety disorder. Cannabis. The use of cannabis can trigger panic attacks and increase anxiety in predisposed individuals. Medications. Some medications, such as antidepressants and antipsychotics, may have side effects that include anxiety. 9. Biological and hormonal factors. Studies demonstrate that women are more prone to developing anxiety than men. The reasons for this difference are not yet fully clear, but hormonal, biological, and environmental factors may be involved. How do biological and hormonal factors influence anxiety? Hormonal factors. Hormonal fluctuations during the menstrual cycle, pregnancy, and menopause may increase anxiety in some women. Biological factors. Differences in brain structure and the functioning of the central nervous system may make some individuals more susceptible to anxiety. 10. Sociocultural factors. Social pressures, unrealistic expectations, discrimination, and other sociocultural factors can contribute to the development of anxiety. How do sociocultural factors influence anxiety? Social pressures. The pressure to succeed, maintain a perfect body, have a bustling social life, and uphold a flawless relationship can induce anxiety in many individuals. Unrealistic expectations. The demand for immediate results, difficulty in coping with mistakes, and the need to be perfect in everything can contribute to the development of anxiety. Discrimination. Being discriminated against based on race, gender, religion, sexual orientation, or any other reason can lead to social isolation, low self-esteem, and anxiety. Understanding the diverse risk factors for anxiety is essential for the prevention and effective treatment of this disorder. By identifying the factors that may make you more prone to anxiety, you can take steps to protect your mental health and build a calmer, more resilient life. What to do if you identify with these profiles? If you resonate with some of the mentioned profiles and notice that anxiety is affecting your quality of life, fret not. There are several strategies that can assist you in coping with this disorder. Seek professional help. A psychologist or psychiatrist can assist you in understanding the origins of your anxiety and recommend the most suitable treatment. Take care of your physical health. Regular physical exercise, a balanced diet, and quality sleep are fundamental for mental and emotional well-being. Envision your body and mind as a team. The better cared for the team is, the better it will face life's challenges. Practice relaxation techniques. Methods like deep breathing, meditation, and yoga can help you control anxiety and find moments of inner peace. Consider these techniques as a toolbox for dealing with stress and anxiety. Develop healthy time management habits. Learn to prioritize tasks, delegate responsibilities, and say no when necessary. Avoid procrastination and organize your routine to reduce stress and feelings of overwhelm. Reduce caffeine and alcohol consumption. These substances can exacerbate anxiety symptoms. Opt for relaxing beverages like chamomile tea or lemon balm. Surround yourself with positive people. Social support is essential for dealing with anxiety. Maintain healthy relationships with family and friends who offer you support and help you face life's challenges. Cultivate gratitude. Practicing gratitude for what you have in life can help you focus on the good things and provide you with a more positive perspective. Recognizing risk factors and adopting healthy habits are fundamental steps for the prevention and management of anxiety. If you suspect that anxiety is taking over your life, do not hesitate to seek help. You are not alone in this battle. Anxiety is a common condition, and seeking help is a sign of strength and emotional intelligence. Frequently asked questions. Question 1. Can anxiety be cured? While anxiety cannot be permanently cured, it can be successfully managed through treatments such as cognitive behavioral therapy, medication, and lifestyle changes. Question 2. What are the physical symptoms of anxiety? Physical symptoms of anxiety may include heart palpitations, shortness of breath, sweating, trembling, headaches, digestive issues, and muscle tension. Question 3. What treatments are available for anxiety? Treatments for anxiety include cognitive behavioral therapy, medication, relaxation techniques, physical exercise, meditation, and lifestyle changes. Question 4. How can I help someone with anxiety? You can assist someone with anxiety by offering emotional support, listening empathetically, encouraging self-care, promoting professional help seeking, and avoiding judgment or criticism. Question 5. What is the difference between anxiety and stress? While anxiety and stress are related, they are two different experiences. Stress is typically a response to a specific situation, whereas anxiety is excessive and persistent worry about the future, often without an obvious cause. We have reached the end of the audio, which profiles are predisposed to anxiety. Did you like this content? Share with someone who needs support right now.